All right, let's talk about bleeding in pregnancy. I'm going to go over some of the reasons when this can happen when it's absolutely normal and nothing to be concerned about, and also some common times when we would want you to page us and let us know what's going on with you. This list is, of course, not exhaustive, but it's just some of the more common things that we run into. So I'm going to start off with discussing spotting versus bleeding. So it can be very normal to spot a bit during pregnancy. Your cervix gets a lot of blood flow as your uterus grows to accommodate your baby. You send nutrients to your uterus and the placenta by your blood, and your blood volume increases by about 30 to 50% in pregnancy. Spotting is often a couple drops of diluted pinky red blood or some dark old browny red blood. You can spot from your cervix if you are dehydrated, if you've had penetrative intercourse, or if you do any strenuous physical activity, and sometimes that can just be running after a toddler all day. If you notice you are spotting, slow down, have a big glass of water, and monitor your bleeding. Spotting from your cervix usually isn't a concern. You can also bleed, however, from cervical infections like chlamydia or gonorrhea. So if the spotting is persistent and you have concerns about infection, your midwife can run some tests for you. Other common reasons for spotting are hemorrhoids. So if you're not quite sure where the bleeding is coming from, you just, you noticed it when you went to the bathroom and you wiped, or you saw a little bit in your underwear, dab some toilet paper to your anus to check if the bleeding is actually anal and not vaginal. Sometimes you don't really notice you have hemorrhoids and it just feels a little bit itchy. If you actually think about it, it's not always painful. So we can help you out with those hemorrhoids if you do have them. You can also try doing things to increase your platelet count. So take chlorophyll or blood builder supplements. Make sure you're taking your folic acid supplements, and you can eat foods that are high in vitamins and minerals like cucumbers, papaya, leafy greens, and fish oil. So in contrast to spotting, if you are bleeding like a period, like the blood is frank, red, and continuing, that is not spotting. That is antepartum bleeding, and your midwife will want to know about it. Please page them. If you have any pain associated with your bleeding as well, we would also want to know about that. I'm going to go through this now by time frame. So we're going to start in the first trimester. So vaginal bleeding happens in about 25% of early pregnancies. About half of these people will have a miscarriage or a non-viable pregnancy. But this also means that half of people go on to have a super healthy pregnancy after vaginal bleeding in the first trimester. If you have vaginal bleeding, let your midwife know. They will either meet you to listen to your baby's heartbeat and assess the bleeding, or send you for an ultrasound. Maybe both. If your fetal heart rate is heard, this is often reassuring. If your pregnancy is not viable or you are having a miscarriage, your midwife will refer you to the early pregnancy clinic for support and help answer any of your questions that you have about your options for care. If your pregnancy is viable, sometimes we can see reasons for the bleeding, such as a subchorionic hemorrhage, which is a little bleed behind the placenta. In the majority of cases, this is not threatening to your baby or your pregnancy, and it often resolves on its own. Your cervical length may also be assessed. If it is short, your midwife will create a care plan with you to address this. If you are Rh negative, you may also be offered RhoGAM if you have any uterine bleeding. Take a look at the injections in pregnancy video to learn more about that one. Okay, moving on to the second and third trimester. So in the second trimester, around 18 to 20 weeks, you will be offered your anatomy ultrasound. One important piece of information that we get on this scan is where your placenta is located. If your placenta is located near or covering your cervix, your midwife may give you some instructions like refraining from penetrative intercourse or strenuous physical activity and ask you to page with any vaginal bleeding. If you have significant vaginal bleeding before 20 weeks gestation, you will be assessed through the ER at the hospital. If you have significant vaginal bleeding after 20 weeks, you will be assessed in the labor assessment unit by your midwife. You may also be offered repeat ultrasounds to assess the location of the bleeding or your cervix if the bleeding is determined to be coming from your uterus. As you reach term, so 37 weeks forward, your cervix can sometimes get itself ready for labor. It might soften and dilate a little bit and change. And because of this, you might have some spotting, You might lose your mucus plug, and you might have some bloody show, which is like a bit of bloody mucus. This is normal and not concerning as long as you do not have any pain and your baby is moving like normal. Relax, hydrate yourself, and trust that your body is doing what it needs to do to get ready. Again, if you are bleeding like a period or having pain associated with the bleeding, please let your midwife know. Your midwife will answer any questions that you have and make a plan with you if you have any risk factors. As always, if you have any urgent concerns, please page your midwife.